So lately, the social media and the general public here in the Philippines, and especially in the province of Cebu, were stunned when news came out that personal air purifiers are required for drivers and conductors of public utility vehicles.
What?
Issue naman ng ilang PUV drivers sa Cebu ang utos na dapat ay may suot silang air purifier tuwing namamasada. Saksi, si June Veneracion.
This news was supported by this memo that came from the local government unit.
Mapa jeepney, bus o taxi, lahat ng tsuper at konduktor sa Cebu Province dapat may suot ng portable air purifier. Maliit na electronic device lang itong sinasabit sa leeg na nauso nitong pandemya dahil napupuksa raw ang COVID virus.
So the question is, are wearable air purifiers really effective against COVID? But before that, one might ask, what are air purifiers and how do they clean the air around us? These are the basic parts and function of a real air purifier. First, an electric air pump sucks the room air into the system. Next, the air is channeled to a high-efficiency particulate air filter, which are commonly called as HEPA filter. This filter is regularly replaced as it accumulates filtered materials, which progressively degrades its function. Next, the filtered air goes into a UV light chamber to kill all microorganisms such as bacteria, fungi, and viruses. These live microorganisms are inactivated by direct exposure to ultraviolet light and the ozone produced by the UV light itself. These UV lamps are also regularly replaced as their efficiency degrades through time. And finally, the filtered and sterilized air is pumped back into the surroundings. Hospital or medical grade air purifiers look like this. They are as big as your refrigerators, and some are wall mounted like this one. Also, there are smaller portable air purifiers for home and office use, all of which contain air pumps, HEPA filters, and UV light. So how about these wearable or necklace air purifiers? Do they have the same components? I looked through several websites of these gadgets to search for schematics of their components, and this is the only one that I found. Its primary component is a negative ion converter. No air pump, no filter, no UV light. Their manufacturers claim that these gadgets emit negative ions that is supposed to protect you from pushing away pollutants from your breathing space. Now, are these claims validated or supported by scientific data? So, I did more searching, and this is the only scientific research that I found regarding wearable air purifiers. This research only looked into the wearable purifier's particle removal capability and ozone emission. It did not test its capability to inactivate live microorganisms such as viruses. Ozone, or oxygen with 3 atoms, is a highly reactive substance and is effective in inactivating live microorganisms. However, ozone can also damage human tissues, especially the lungs, when exposed to it in prolonged periods. And this scientific journal concluded that of the 4 brands tested, 1 was effective at removal of particulate matter and 2 brands had obvious ozone emissions. It illustrated that some wearable air cleaners will lead to elevated ozone concentration within the near-head region. It recommended that guidelines are needed on the use of these devices to mitigate particulate matter exposure without increasing ozone exposures. Now here is a video by my friend and med school classmate Dr. Dilbert Monisit. He deliberately popped open a wearable air purifier to see what's inside, and no air pump, No HEPA filter, no UV light were found. Obviously, these components will not fit in this small enclosure. So now, what does the health authorities and the health experts recommend about these wearable air purifiers? In the official website of the DOH, the department posted its official stand on these devices. On October 30, 2020, the Department of Health issued a statement clarifying that it is not endorsing the use of wearable air purifiers to protect from COVID-19. Also, the Philippine Society of Microbiology and Infectious Disease posted on their official website the Philippine COVID-19 Living Clinical Practice Guidelines by the Institute of Clinical Epidemiology, National Institute of Health UP Manila, in cooperation with the Philippine Society of Microbiology and Infectious Diseases. The said guideline cited a clinical research by Donis et al. Entitled, "Is an ionizing air filter effective in reducing SARS-CoV-2 virus transmission in public spaces with sustained community transmission?" The research mentioned that no direct evidence was found assessing the effectiveness of ionizing air filters in reducing SARS-CoV-2 infections. The findings also reiterated that ozone, a dangerous respiratory irritant produced by some ionizing air purifiers, is a health risk to users. The experts concluded that ionizing air purifiers are ineffective and recognized that the harm caused by this intervention outweighs its benefit because one of the apparent disadvantages of ionizers is the emission of ozone, a powerful oxidant that may inflict health hazards through long-term or high-dose exposure. And with this consensus, the experts recommend against the use of ionizing air purifiers. To summarize, we need to answer our original question. Are wearable air purifiers effective against COVID-19? No, they are not effective against COVID-19 or any other microorganisms. Also, they are a real health hazard due to ozone emissions. These devices may create a false sense of security, making their users abandon important basic health protocols. And lastly, they are very costly, ranging from several hundred to a few thousand pesos. They are more expensive than proven effective modalities like wearing a mask and social distancing. Thank you for watching and keep safe.